We were very interested in looking at this here in Utah because unfortunately we know in the winter we tend to have pretty severe air pollution, but we think that these results are really applicable to cancer patients across the United States. There's approximately 16 million cancer survivors in the US, and we know unfortunately about 40% of the US population lives in places that are considered polluted at certain times of year. And so we are very motivated to really understand how environmental health factors may affect cancer survivors.
We found that pediatric, adolescent, and young adult survivors of childhood cancers are at a risk for hospitalizations, and ED visits, meaning emergency department visits, after breathing in fine particulate matter, which is air pollution found here in Utah. Survivors who were treated with chemotherapy have a higher risk than survivors that did not receive chemotherapy as part of their treatment. And we also found that the risk among chemotherapy-treated survivors was significantly higher than the general Utah population.
Overall, the results surprised us in that the effect that we saw was actually higher than what we anticipated. We figured because we know air pollution does cause lung or respiratory health problems, and we know unfortunately cancer survivors do have an elevated risk of these health problems, that we would potentially see an effect. But I think sort of the elevated risk that we saw and that it was really elevated for those who had chemotherapy surprised us.
Moms and dads can do a lot to help reduce their child's exposure to air pollution. So one thing that they can do is to purchase air filters to install in their home, such as HEPA filters that will filter the air throughout the whole house's ventilation system, as well as individual air filters for rooms that the child spends a lot of time in. Schools will sometimes bring in children who they know have pre-existing conditions from recess to spend the recess indoors on days where they know that the air pollution is bad, and so letting the school know that their child is a cancer survivor could help the teacher know when to bring the child in.
The main takeaway for this is that we may actually need to rethink some of the guidelines that we have both on air pollution from public health agencies as well as guidelines that we're giving for cancer survivors.